connecting patients, co-workers, and communities. This is the Sutter Broadcast Network, the pulse of Sutter Health. This is Sutter Health Reports.
It's been about 10 years since the Institute of Medicine's report To Err is Human came out. Have we made any progress?
I think we have made a lot of progress. That report really created a tsunami, a wave of focus and interest across the United States, really across the world, on patient safety and quality. And at Sutter Health, we embraced that report. We looked at it and said, we have a long way to go. Since that time, Sutter Health has enacted a number of patient safety and quality initiatives, and we track what we're doing. We have a dashboard that is specific for quality with metrics that we report nationwide to our state and among ourselves. Our medical groups have a dashboard that is focused on patient safety, and I believe that Sutter Health has really been a leader in embracing the whole wave of quality and patient safety.
Why is that sort of data tracking important? How does it help improve patient safety?
You know, they say in medicine that what you don't track, you don't do. So anything that you focus on and you decide on goals and you set metrics, you measure yourself, you see how you're doing. And one of the things that we do at Sutter Health, we are brutally honest with ourselves. We know where we need to improve. We all come together, work together to make those improvements, and then we share the information that we have with others, both within our system and nationwide, so that everyone can be brought up to a new level of quality and patient safety.
We also share that information with patients.
We do. We have a website. If you go on the Sutter Health website, it's sutterhealth.org, you can actually go to our quality dashboard, and you can go to any hospital within Sutter, any medical group within Sutter, and actually see how they perform. And it's not just the quality dashboard. Each of our hospitals and medical groups has other quality metrics that they decide on and use themselves to track how they're doing.
What else can patients do to get involved in their own health care, or maybe in the health care of a loved one?
You know, probably the most important thing is a patient really partnering with their doctor. If you have a doctor that knows you, that has been with you for time, that doctor knows what's going on with you, and you can be very transparent in telling the doctor everything about you, and that's going to help you later on if you come down with an illness. I also encourage everyone, if you have a loved one that's in the hospital, it's really important for that person in the hospital who's sick and who probably isn't paying attention to have an advocate there with them that can question things. I'll give you an example just to kind of make it real. Let's just say that you're in the hospital, your loved one's in the hospital, and the doctor makes rounds, and the doctor says, well, we're going to be changing your blood pressure medicine today. When the nurse comes around to deliver medications, if you see that she's giving a medication that the doctor said was going to be discontinued, it's important to stop and ask that question. You know, just press a little bit and make sure that you get the answers that you want. Having an advocate is one of the most important things that a hospitalized patient can do to ensure that everything's going the way it should.
What if you're just going to see the doctor? Are there things you can do to be more involved in your own health care, even if you're not in a hospital?
One of the most important things, and where most medical errors actually occur, is with drugs and improper medications or giving the wrong medication. So the most important thing you can do if you're taking medication is have an accurate medication list in your pocket that you take to the doctor.
So let's say you're a patient, you're going to see your doctor. How should that visit go? What should be the process? How can you make the most of that appointment?
You know, I think the main thing is to know what you want out of the visit. If it's just a regular checkup, then that's one goal. If you have a problem, it's important to state the problem up front so that the doctor knows why you're there and you can kind of manage the time. It's really important for you as a patient to listen carefully to what the doctor has to say. And don't be afraid to take notes. You know, have a little notepad and write down, because we've done studies and it shows that patients forget 90% of what was told to them. We all do that. I mean, it's kind of human, especially you're in an anxiety-provoking situation to begin with. So don't be afraid to take notes or to ask the doctor to repeat what he or she has said.
Medical errors can occur, and fairly frequently, in the world of medications.
Right.
What can a patient do to step in and intervene in that area?
It's really important, because that is where most medical errors occur, is with medications. If you're getting a new medication from a doctor, there are 5 things you need to know. And if the doctor doesn't go through these 5, don't hesitate to ask. The first one is, what is the name of the medication? Second one, what are you treating me for? What's the medication for? The third one is, how do I take this medicine? Is it once a day? Is it twice a day? Before meals? How do I take it? The fourth one, and this is probably the most important, is how long do I take this medication? Is it for a week? Am I treating a certain thing that'll be over in a week? Or is it something that's a prescription you expect me to renew and I'm going to be on it indefinitely? And the last one is, are there any side effects or any drug interactions that I should be aware of? And that's where having your own medicine list really comes in handy, because that way the doctor knows exactly what you're taking and can advise you if there is anything that you should watch out for with other drugs.
Once again, Sutter Health is concerned about patient safety, is concerned about providing quality health care. What are we doing to really help in that area?
Sutter Health has made a strong commitment as an organization to being top decile quality. That means our goal is to be in the top 10% of the nation for every aspect of the quality dashboard, what we track and what is tracked nationally. We expect patients will come to us, and anything that we can control about their illness, and we all know there's lots of things about an illness that are out of any doctor, any hospital's control. But anything that we have control of, we want that patient to come to Sutter Health, to our doctors, our nurses, our healthcare providers, and end up better off than they were when they walked in the door. No errors, that's our goal, no excuse.